This is Boomer Life on CIL 650.
Welcome back to the program. Sterling Fox with you, joined in studio by Dr. Jan Venter from Falls Creek Healthcare Center. We're talking, among many other things, on the program this morning, Dr. Venter, about brain health. And, of course, you've been describing with great gusto the tools, the equipment, the gear you have at your disposal at Falls Creek Healthcare Center. It is truly remarkable. What specific implements or devices do you have that focus on the area of brain health?
So very privileged to have free Tesla MRI, which is very fast MRI that can peek into the anatomy of our brains. We have quantify EEG as well as evoke potentials to look at the way the brain's working, as well as specific what we call functional and genetic blood tests that we can send out and help us to determine risk for things like concussion, dementia, Parkinson's,
right.
Those kind of diseases.
Concussion is a brain injury, correct?
Correct.
And once one suffers a concussion, is there an immediate predisposition to greater injury the second time around?
Correct. We know usually within the first 10 days, some research paper says about 6 weeks. And usually one concussion, most people can heal within 80% specifics within 10 days. But as for those multiple repeated concussions, a lot of our listeners probably have had a few sport injuries in their life, or fell from the swing, or got hurt in boxing or playing hockey. So we have the capability to pick that up now with our sophisticated brain imaging, as well as to treat. And one of my oldest patients I've treated for concussion was well into his 80s.
Interesting. So again, you keep repeating, it's never too late. There's no reason to suffer in silence, is there?
Correct.
Any longer. Regardless of what the ailment may be, there are professionals, skilled professionals with great equipment who can help you get, maybe not 100% better, especially if you're 80, but who can certainly improve the quality of life dramatically.
Or at least delay the significant deficit that can happen.
One of the things we worry about a lot on Boomer Life, because it comes with the membership card, is brain health, and specifically dementia. What's Alzheimer's? Is it a form of dementia, or is it a type of dementia unique and different from other types of dementia?
So it's probably the most significant form of dementia, is the well-known forms of dementia, and probably the most rapidly accelerated type of dementia as well. And the sad part is if you get diagnosed with Alzheimer's, usually we don't expect, or the prognosis is 4 years
right.
with dementia. So these other types of dementia called vascular dementia. There's dementia from multiple concussions.
Right.
There's dementia because of certain lack of brain nutrients like B12.
Interesting stuff. So you talked about that out of necessity, finding that kit that could diagnose a little kid in strep throat in 3 hours, 3 minutes.
Correct.
Do we, or is medicine achieving the same sort of diagnostic success with Alzheimer's and human predisposition for dementia of all sorts? Blood tests, or I mean, it sounds too good to be true, but I know that that's what scientists are working on. How close are they?
I think we're getting very close in many different regions, and I believe the ultimate answer is going to be not a magic bullet, but combining all these techniques. Combining blood tests, genetic tests, some of our advanced brain imaging. There's a neuroscientist I've been working with who has developed a technique that can diagnose brain health within 10 minutes.
Oh, okay. So it is coming.
It's
right.
coming, and I think combining those things at a center like Falls Creek, we have access to all those technologies, which I'm very, very privileged to have to my disposal.
Well, you're very lucky, too. I mean, because you do good work, and you're surrounded by people who do the same caliber of global class work, and again with the equipment available to you, and the fact that you are able to work as quickly as you do. I think that's the one thing about Falls Creek Healthcare Center that, above all, we need to understand. Things happen very quickly. If you go in, you can get in within 24 hours if you make the right phone call and have the right set of circumstances. But once you're in, the whole process is as accelerated as you need it to be.
Correct. Or as slow down as you want. Some people want to come back and think about it first.
Right. But I suppose it's the fact that the options are available
Correct.
in a milieu or in an environment that offers those possibilities rather than one size fits all.
Like I like to say, it gives the patients back the choice.
Right.
For their own health care.
Well, I'm afraid we're fresh out of time right now. And you are involved in such good work. You wrote an article for a magazine on 10 superhuman ways to grow and protect your brain. We don't have time to go through it. What magazine did you write that for, or is it on the Falls Creek Healthcare website?
It's on the Falls Creek website. When Sterling mentions the website, please download it and make this your own.
Right. It's all about brain health. And boomers, well, we care about a lot of types of health, and brain health is certainly up there. So it's a great article. Check out the website, fallscreekhealthcare.com, and look for Dr. Jan Venter's article on ways to grow and protect your brain. A real pleasure to meet you. Thank you so much for coming to our studios. We appreciate the extra effort involved there. It was a fascinating conversation. Please come back again.
Thank you very much, Sterling. It was an absolute pleasure.
Dr. Jan Venter. This is Boomer Life this time around. We'll see you next time right here on CIL 650.